20th, 2020 will come to order. We have all committee members, plus we have other commissioners, Commissioner Cook, Commissioner Duncan, and the chairman going with us. We have two items. We have the approval of the minutes from April 15th, the committee meeting, and then we have a discussion on self-funding health insurance options. At this time, we have no one for public comment. So if we go to approval of the minutes, and when one of the committee members are satisfied that the minutes are complete as written, I'll take a motion to accept the minutes. They're very detailed.
It's in very detail, sir. It's in good detail. Sir, I make a motion that we accept the minutes as presented from April 15th.
Second.
Okay. Any questions, additional comments from anyone? Okay. Got a motion and a second. All those in favor of the motion, please raise your right hand. Minutes are approved. Next item on the agenda is the discussion of the self-fund health insurance program. Ms. Bender.
Ms. Janice, which order do you have? Do you have the slides that the commissioners were sent in advance, or are they in their packets?
They're in their packets. They look a little different because to save ink, I took off the background of the dark color.
That's mine, so this is
Oh, thank you so much. Okay. So the first item that you have,
Can we do something before we start?
sure can.
Here's, as a measure of comparison, what's going on now and what we're talking about. Our current insurance is with United Healthcare, and from what I've heard you say that the employees are feeling pretty positive about the plan.
Yes, sir.
Okay, and we're paying, what, $2.2 million in premiums a year?
Approximately so, yes.
Okay, and I know our disadvantage is the fact that we're a small group, and that's never going to change. There's also this terrible pandemic that's going on, and we don't know what's going to happen, if the costs are going to go up and everything. John, can I ask you, when you do the budget, I know your budget starts in July,
Yes,
so
sir.
you have like a 4-month period where, from March until June 30th, where there's going to be a new policy coming in
Yes.
this year. And so you allowed additional money, I'm assuming, for those months?
Yes, sir, because the renewals take place March 1st for the coming budget year. 8 months of that budget year are already set,
Right.
with the exception of change in circumstance where an employee changes coverage from married to single or vice versa.
Right, and then.
Or adds a family
Yeah.
member. And
Okay.
then we take those monthly rates and project them with a 15 to 20% increase typically for the last 4 months of the year to get the annual amount.
All right, so the 15 to 20%, and that's an ongoing thing.
Yes,
It's not
sir.
just a one-time deal.
Yes, sir.
All right, so then if we're looking now at this self-funded and we're thinking about a 3-year period, we're talking about a 45% increase, essentially, we're looking at, if we take 15% a year. And that's on your lower end, right? All right, so the 2.2 million goes way over 3 million in 3 years. Okay, so when you
For-
think about
as
that.
far as a budget, yes.
Yes, as far as budget.
and-
Now, I mean, we obviously can't see to the future,
Yeah.
but.
In
I
some
mean,
years, we've had 4 or 5% increase. Other
Okay.
years, it's been more towards the
Yeah.
15.
And there's a lot of factors that we can't control because the insurance company controls.
Yes, sir.
The size of our group. We don't know what's going to happen to Obamacare. There's a case pending in the Supreme Court. Could have an impact on insurance and insurance rates. So what I'm thinking is, we're sitting here and we almost feel vulnerable because 45% increase is kind of like beyond belief that you can think about that. And this morning, I guilty admit I went to Starbucks on the way this morning, but I drove along Altama, and as I drove by the college,
Yeah,
saw
I seen it.
I seen it. More than 200, maybe 300 cars
Yeah.
waiting in line for food.
Yep, seen it.
And, you know, it's such an impact because you say to yourself, we can't raise rates. You know, we have people scraping money together every month to pay their bills, and there's people waiting in line for food. So we have to find some way to get some control over this. And I'm hoping that, you know, this plan that we're presenting here is going to make an impact so we don't feel like we're out of control and things just go on a runaway. Because it's a benefit that has to be here. It's great for recruiting and it's great for retaining people. And in this climate we're in, it's essential for people to have health insurance. Even though there's 28 million people in this country that don't. But our employees do, and they have a pension and health care, and we need to retain our employees. So that's my little preach for the beginning, so please, I just wanted to give a little perspective on where we are and where we're going.
Well, you can continue if you'd like. You were doing a great job, I think, taking us right where we were going.
I don't want to take any of your thunder away here.
Well, no, that's okay. It's all your thunder, actually. So in conversations about a self-funded, I think that most everyone is feeling pretty positively about the numbers that we've seen so far, that we could have a savings more often than not. And those times that we do have cost versus savings, the cost seems to be more minimal than the overage and rebates or savings, I guess as you would say, in claims. So it makes a lot of sense on paper. What we did this time was Mr. Burrows did some simulations so we could see what 100 different ways of looking at it could look like, and then we looked at the actual numbers and gave you those comparisons as well. So what we sent out by email was a 5-year comparison that Mr. Mayor asked for, Commissioner Neal asked for. What were all those terms again? So we sent all that information, and then just some other generic information so you could see what the numbers look like if we average them all times the 123 current employees, what were the actual numbers for each year, and that's what we're looking at today. So please interrupt anytime. What we're trying to do is say, does it make financial sense? It did a month ago, does it still? So do you want to start off with this simulation?
You go
because
ahead.
it's on the board? Okay, so in your packets, you're going to see first, these are just the pros and cons. I'm not going to read something you have right in front of you. I don't want to take up any of your time. Did anyone have any questions about the pros or cons or any of the terms?
Yeah, I did.
Okay.
What was the bid in there, and why was it in there on the state of New York?
So when you have a self-funded plan, you have to sign up with the Department of Insurance in New York. It's a separate contract to say if any of your employees on this plan visited New York and accessed health care services, that they would actually they would be charged a reduced rate. So it's just paperwork, but it is another administrative task that has to happen. And one of the questions you all had before was, what is the additional work going to be on the staff or the extension of the staff and teamwork services? And so that was just on the list. New York is its own island. So that all the rules in New York are a little different, and all of the self-funded companies have to do that. It's just something that they have. One of the other things that you'll see that was highlighted was we talked a month ago about what is COVID-19 going to look like for healthcare and claims. Well, as we know, the healthcare system has sort of come to a screeching halt because people are not going to hospitals. But we anticipate that as soon as things lax up, people are going to start having those surgeries that they have put off before, so we could see an influx of claims on that. But I don't know that we're going to see the COVID cases in the hospital as we talked about a month ago. It's interesting what a month makes.
Councilman, let me ask this question. Have you had any COVID cases within our workforce?
We've had no actual confirmed COVID cases. There's been a couple that have been suspected that test, but they took their 2 weeks off, and we've had no confirmed tests.
Okay. And then we have the fully insured and self-insured differences in terms, and we just went over the New York. There is going to have to be that seed money account we talked about, so there are some things internally that the staff is going to have to do, and they may have to get approved.
HIPAA security person here.
You actually have a team of HIPAA security people with Teamwork Services. So one of the wonderful things about using Teamwork Services is, one, you have a team of people who work for the commission. So you all get to they do, which is wonderful. You also have a team of people that are experts in their field, so that is all covered there. There will be one or two people on Teamwork Services, but that's going to be Ms. Roberts or Mr. Burrows or Mr. Donaghy. So it's going to be a tight end.
Internally also.
Yes.
Yes. And I'm assuming that employees understand that their health care rights and protections are all under HIPAA, are all the same, whether we pay an insurance company premiums or whether we do self-funded plan. Those
Correct.
don't change. Your health insurance is your private matter between you and your provider.
And there may be some additional steps that we have to take in further discussing some of the claims information in ongoing meetings. Obviously, this is an open public meeting. We have it recorded. It's available for anyone to view. So we might have to talk to the attorney a little bit more about how we conduct those conversations so we stay out of those areas that might even appear gray. We're going to have more claims information than we had before, but even the claims data that we get is going to say this person has this, or it may say a person has this, and this may be the demographic, but it won't say John Doe. So we could get it to say John Doe, but we would probably request that they not tell us. Yes, sir. Okay. Terminal liability, we'll go over that in just a moment. And then these are just additional documentations you have to have with a self-funded plan. And then we get into this chart, which is the 5-year review. So on the 5-year comparison is broken down by year in each of the individual stop-loss levels. So what we wanted to do is see if we looked at the 50,000 stop-loss, 75,000 stop-loss, 100,000 stop-loss, what would that look like if we plugged it into the past 5 years? So let's just assume for the conversation that we are moving toward self-funded. The next question you have to answer is, what level of stop loss do we want, 50, 75, or 100? And these numbers might help answer that in addition to the simulation Mr. Burrows has to present in a few minutes. So on the 50,000, you can see that the fixed cost is going to be the same all the way down because we applied it to all years. The terminal liability and additional benefits, that just means if we're trying to put together a plan that looks like the plan they have, then we would add in those additional benefits, and we'll go over that in detail. The expected claims, the claims paid over the stop loss amount, so what claims were paid over 50,000, over 75, and over 100, and then we tried to make it pretty simple and said, what would the estimated cost have been if you had been self-funded at the time? And then what was the estimated cost of the fully funded? And when I say estimated, the information that insurance companies give you is, and they'll give you 2 or 3 numbers that are very close together, and we just average them. So they might be $1,000 off. So you can see that in 2019, had we been self-funded, there would have been a significant difference. We would have spent around $1.6 million instead of 2.2. So that's a significant difference, even with some of the medical conditions we had in place. We had another carrier that we were speaking to that would not quote us because of conditions we have that are ongoing. Yet the claims say we're not seeing that. The insurance company is an underwriters, and they're a different group. They have to look at what they think might happen very, very conservatively. So they have to make their choice on what they're going to give us as a rate. And that's why we end up with these high increases, even if we don't see the claim showing that. So we can see that the 50,000 would have been 1.599 million. The 75 was 1.6 million. And the 100,000 is 1.7. So you're obviously going to save more if your individual stop loss is 100,000, but I don't know that you have to go all the way to 100,000 to start with an individual stop loss. Maybe you all decide that you want to start off with a 50,000 individual stop loss, and then reevaluate a year and see how claims run. That way, you don't have to have such a maximum liability if you had a terrible claims year, if everything went wrong.
So is the individual stop loss, is that an absolute fixed amount?
It is an absolute fixed
So in other
amount.
words, the minute any one of the people that's making a claim goes over the 50,000 once, then we are not liable for that. The insurance then, the stop loss insurance then picks up the remaining.
The stop loss insurance starts to pick that up, yes. And then there's a cumulative number that there at the bottom that says, once all of those collective over 50, 75, or 100 meet this number, then we pay the next million. So there's a stop loss individually and a stop loss aggregately for the whole group. So sort of two trampolines.
One question I have, is the 50,000 on each claim, or is that on the total treatment package?
That is on a person. That is on one person for a whole year.
For the whole
For
year.
the whole year?
Yes.
Okay, that's what I.
So the minute you go over the 50,000, we don't, that's the most we could pay for any, if we choose that.
For a person, yes, sir. Not per claim.
That's the most we could pay a year unless our total claims went $1 million past the
Right.
attachment point, and then we'd start paying
Yeah.
after that.
Then you would. And I've gone round and round with them and asked experts and made calls and done research. It's almost impossible. It's possible, but it's almost impossible the way that they figured it to go over that million. But that is the case. That's what I said. So we go over $1 million, you're paying that, yes. So that shows 2019. So what about 2018? And notice green means it was a good year, and red means it wasn't a good year, it might not have been a good year. So 2018, even better, $1.4 million, but of course the premium was $2 million. Keep in mind too, we have employees, we have 123 employees on the plan, but we have about 150 or 60 employees. So one of the wonderful things you've done as a commission is you've made the plan accessible, but not so rich that everyone says, let me not have my spouse's plan or my TRICARE or my retirement, I'll take this instead. So you do have a good amount of employees that don't take the insurance. So sometimes you'll see a fluctuating number, but what we did in this chart is we made everyone 123 people so you could see apples to apples. Then in year 2017, Blue Cross and Blue Shield did not release information about claims. They said this is how much you paid in premium, this is how much you paid in claims, but they never released information on how much those claims were. So we didn't know if someone had a hysterectomy and it was $25,000, we could not apply that. So all we knew is claims versus paid, and they gave us a 47% increase. We were with Blue Cross and Blue Shield for 1 year. When we received that 47% increase, we went to another carrier and obviously brought the cost down by going to that other carrier. And funny enough, that would have been 2018, where we would have made about $600,000 had we been self-funded, which means Blue Cross had it wrong. Their underwriters might have seen that there was something on the horizon, a big claim that never happened, or that claim didn't cost as much as they thought, and so the next year it wasn't that bad. So then we look at 2016, and in 2016, we would have been about $200,000 upside down. So you can see that year we had a poor claims year, and Joint Water, had it been self-funded, would have spent $200,000 more. But in the other years, we're saving $400,000 and $600,000. So then we look at the 2015, and you can see that there's about $350,000, $360,000. Any of them can do that math probably just like that, for that period of time. So
How much did you consider for inflation on that?
we didn't, we were asked to,
Just compare number to number, that's all you did, huh?
we did. We just said if we take 123 single employees and plug them into these claims first we plugged them into the premium, so the premium would be equal, and then we plugged them into the claims, so you kind of have an apples to apples view.
Okay, all right.
So then on the next page, these are the actual numbers. So there are no averages. You'll see in 2019 and 20, we had 122 employees. First column shows the 5-year period. Second column shows how many employees we had. You'll see in 2015 with Signal, we only had 99 employees on the plan. So the organization has grown and more people have taken insurance. But you'll also notice that when we get over, so we have actual claims in green, then the actual premiums in the middle in yellow, and it's kind of interesting when you average out what those premiums are, sort of how we've moved up over the years. It's gone up, but it's not gone up as significantly as the renewals we've received. So even though the budget has said 15-20% every year on fully funded, we've not always seen the 15 to 20% increase because we've moved or increased cost to employees or deductibles and reduced benefits. With a self-funded, they can't hide from you anymore. They can't say, oh, well, it was so expensive, because now you're the insurance company. You get to peek behind the curtain. The only thing they're charging you for is administration. So if there's a high claim, they have to prove it to you. It's no more of this, just trust what we say. Any questions on these actual numbers? I think just to summarize, it shows that if we look at the 5-year period and equalize everything, you're seeing that 3 out of the 5 years you would have saved a significant amount, and 2 of the years you would have spent some more, but not nearly as much as you would have saved, and it would have paid for itself. So just in general, you probably over that 5-year period of time would have looked at around $600,000 or $700,000 on a conservative side that you would have saved had you had self-funded. All right, and so the next piece is just these very tiny numbers that I wish could have been even bigger for me. This is just the proposal we went over before, and my questions on this are, the first box you'll see is the matched plan design, so that just shows the plan you have. The second set of boxes are the fixed cost for the administration, and then below you'll see optional coverages to be considered. Does everyone see that? Okay. So these are the things that we have to ask. Do we want to put them back into the self-funded plan to make it just like it was? So we're about to embark on a very well done wellness program. If someone smokes or uses tobacco and we remove the smoking cessation program, then we say stop using tobacco and figure it out. But if we keep the smoking cessation, then we can say stop smoking, stop using tobacco, and here's a program that may help you. There's a real appeal weight loss program that actually gives incentives. They can get up to $738 a year per person that participates. So they get all these great little things. Of course, that's coming out of your pocket, but you're only going to pay for it if someone participates. So you're not paying for something no one's using. And below you will see that the smoking cessation we went ahead and included because we knew what the plans were in the future to incentivize people for not using tobacco. The real appeal weight loss, the cost for that is $199 to $738 per employee, but only those who use it. If no one uses it, it's $0. The EAP, the Employee Assistance Program, if you're familiar with those, that is $285 a month, and the Enhanced Behavioral Health Solutions is $113 a month for the whole group. So
That's $285 in total?
in total.
Not per employee?
No, sir, that is in total.
So that's the total, and then, of course, that's utilized infrequently, I believe.
It is very infrequent, yes. When people, and there are some benefits to the EAP program, and that's another thing. We can add that into the wellness information that they receive when they come in. I know that looking at the initiatives from the staff meeting, wellness is, we're hoping to have 50% of the staff members participate in the on-site wellness. That is a wonderful goal to start off with. And I think that the staff is working on some incentives that might excite the staff. So we'll see how that goes.
Does the staff understand that any wellness checks that are done are private? It's just between them and the provider? Is that really clear to them?
We are talking about that, and we had that conversation yesterday. It is very important that we let them know it's private. It may be the difference in them participating at all or not. That the
Well,
the only.
All we're going to get is a number at the end of how many
That's
people.
right.
Okay.
That's right. We're even steering away from things like skin checks. I thought skin checks were a good idea. Well, I forgot to have a skin check. You're going to have to remove something. So maybe that's not a great idea for work. But in the future, we might want to look at something like that. Okay, and then the terminal liability coverage.
One other thing on
Yes.
that page, the enhanced behavioral health solutions.
Yes.
What's it, mental health benefits are already included in the package, so what's the difference between?
So the mental health services are included, but if you are a person in crisis, if you are taking, what this program does is identifies people who are taking certain medications or accessing certain services, and they find them to be in crisis, and they contact them and try to case manage them. So if you find someone is taking multiple antidepressants and maybe some pain medication, and they're seeing psychiatrists, they've been hospitalized with a code of mental health, then they would actually put them under their case management system for mental health. Normally, they would not do that under the medical side, but that's what that enhanced program is. So again, if no one used it, then you have spent that $113 for no reason, but if you used it at all in a 5-year period, it would have value, I'm sure. So that is something that's added to the plan now. That is an additional premium. When it's self-funded, you're building it from scratch, so there's nothing added. When it's fully funded, there's so much meat on that bone, they can throw in all kinds of things and it still doesn't hurt them. Yes, they are very generous with your money. Another thing, terminal liability protection, we talked about this before. The cost of that is $85,000 a year. It is the first year only that you pay for it. If you go with a self-funded plan, you're going to have a 12-month contract. That means any claims that come in that 12 months, they'll pay. If it is the 13th month and you have left United Healthcare to go to another company for any reason, then you are paying all of those claims from that 13th month on. The terminal liability protection says for $85,000, we'll sell you a 90-day policy that says for 3 months after, we will cover those claims, and you only pay that $85,000 one time. I think it is a wonderful investment. It's a safeguard. If we ever left it, we would probably be leaving this plan because claims were high, right? So when are claims going to be high? They're probably going to be high closer to the end that we realize, my goodness, we have to get out of this. So it's just a great $85,000 to spend, and I don't say that every day.
We pay once and then that it's in effect.
Yes, sir.
If we ever terminate.
For the policy lifetime. And the wonderful thing about a self-funded plan is every year we shop around and we move companies. If we can save 10%, we leave. If we've saved less, we've saved more. But with a self-funded plan, all you have is administrative costs. So they're going to charge you for the cost of insurance and the cost of administration. Well, if we have a couple of good claims years, we can certainly say your cost of insurance is a little high based on where we've been. Maybe we can bump that down. But of course, we're talking about bringing $54 down to $52. So it's not huge money that we're talking about. And we are going to see, and I can't say this enough, we are going to see an increase every single year in self-funded, but it's an increase based on a small amount because it's just the cost of insurance. It's trend. What does it cost to offer a health insurance plan? So it's not going to be all these hidden costs of, we're going to give you a 30% increase and not tell you why. So we will.
Guarantees the increase in the fixed portion of it.
Yes, but it's 126 going to 128. So there is an increase, but it is an incremental little small amount compared to the WHAMOs we've gotten in the past.
And having United Healthcare as a third-party administrator, they don't act any differently than they would if it was just a regular paying them premiums, right?
That is exactly right. They do it all.
The same way.
Yes.
Progressive about pricing and
Yes, very much so.
things are done correctly.
Yes, sir. And not only that, we have a situation a lot of times in a self-funded plan, you have a third-party administrator and the reinsurance, and they're different. So you hope that they'll seamlessly work together, and there are always hiccups on that relationship. United Healthcare, in this case, is the reinsurer and the administrator, so it should be seamless. The employees shouldn't feel a difference. They're going to do all the prior authorizations, and that terminal liability protection extends them doing all of those same things 90 days after. Can you imagine the 13th month that we have, that all of a sudden Mr. Burrows is having to say, well, it looks like this appendectomy came up. Let's see if we should pay that or not. Yeah, it might have.
No, absolutely not.
Might as well. He's too close to add another. So,
I think you said before that the administrative fee only applies to the employees, not to
Cor-
the dependents.
no, sir. That's right. And I went back and looked at we had a partially self-funded plan. And that was one of the things that Commissioner Duncan asked about was, can we meet in the middle? Can we do a partially self-funded plan? The problem with a partially self-funded plan is the House always wins. Anything other than self-funded, the House always wins, because they can tell you anything had to go towards administration, and then they'll share with you. Our best claims year, when we ran in the 70% claims ratio, we received 115,000 back in a rebate, which was great. It was not nearly what we had due. If you look at these numbers of what self-funded is, we probably should have seen something like a 500,000 or 600,000, but we got 110 because that was our contract. So we could look at that, but it doesn't get us where we want to be, which is driving our own bus. And they won't let us quote it, or I'd already have a quote for you to see. They won't let us quote it until renewal of next year. Yes, sir. Well, thank you. I'm sorry that the font had to be 4. So one of the other questions that you had was, we're running a little out of time. You all have had a lot to deal with. You haven't been able to meet through some of this, was can we move this to August 1? I did negotiate and they agreed to extend the rate to August 1. If we do not choose the plan for August 1, we have to go back, requote, and start the process over. So that is as far as they will extend our rate. The timeline, if we're going to do this, we do need the 60 days. We have to set up all the information and infrastructure with the staff, and United Healthcare is going to slowly but surely dribble in all of their little things they need. It's almost like refinancing your house. You think you're done, and then you get 6 more emails that have a list of things you have to have done. So it's just a constant barrage of information that takes about 6. Are you refinancing?
No, I said just 6.
Yes. So it's a lot of little pieces, and so what we don't want to do is we don't want to run into even a 45-day period, because the employees have to have all new open enrollment meetings, which they probably won't make many changes, but once that information has been submitted and they've had ample time to think about it, then we have to have new ID cards in their hand by the 1st. So, if it is appropriate to make a recommendation, I know you have a board meeting tomorrow. I do not know what your appetite is for putting this on the board meeting for tomorrow. But if it is too soon and you need more time, if we need to have additional meetings, I'm happy to have additional meetings. I know you have a long day, but I can be here all day if you want to go over anything else. And if tomorrow doesn't work, if we could look at early July, then that...
Early June?
Sorry?
Early June.
Much better, yeah. Thank you. Then we can look at early June, maybe the first week in June. If the meeting was available, we could look at taking a vote then. I just don't know how comfortable you all feel moving forward with this, or what questions you have. So the floor is open.
Okay, so you're complete on your presentation.
I think so, yes.
Okay. Do we need to look at the simulations?
Oh, yes.
Andrew, this is your simulation?
This is me.
Health insurance meets engineer.
Yes,
Okay.
lots of fun with spreadsheets. Luckily, with everything going on, I've been able to spend a whole lot more time in my office, so gotten some of these spreadsheets done. So I got a few histograms here. This first one I ran was if we did not have the stop loss coverage, whether that was the 50, 75, or 100. This was just us paying all the claims when they came up, plus the bare minimum fixed cost that was available for the cost of insurance. Now, The way I did this, they were able to get about 18 months of monthly claims data that I used as a random simulator, and then also simulated the number of subscribers anywhere between 122 and 128 to allow for fluctuations. So I normalized it that way, ran it 100 times. The bottom of this is a little difficult to read. It's kind of small print, but right now, as Commissioner Cook brought up earlier, we're paying about $2.2 million total for our insurance package. That's both employees and joint water sewer. If you look at this one here, that's kind of straight down the middle of that fourth column there. So quite a lot on the far end, and also that bin on the far right is $3.3 million. So there was 1 year on that simulation where we spent $3.3 million compared to the $2.2 we're spending now. So that's certainly going to impact the decision there. So just some general information. Over the 100 simulations, average cost was $2.15 million, which is roughly what we're paying now with no stop loss. However, 32 times out of that 100, we went over that number with a max of, like I said, over $3 million. So essentially with the stop loss, the way I'm considering this is kind of protection for hedging your bets. Certainly we could save money here. The low cost here is $1.4 million. That'd be an $800,000 savings, but it does appear there's a significant chance we'll go over without stop loss. So this is with the $50,000 stop loss, and if you look at this one, you have a high concentration of simulations that ended up in two bins. So you've got 73 times out of 100, you spent between 1.5 million and 1.75 million. So it's very concentrated there. There is 1 year out on the far right end that you spent $2.6 million. So the worst scenario that of the 100 that I ran, now granted I'll run these in first year, we'll spend 2.7, but all the 100 simulations I ran, there was only one that was over, and it was only $400,000 over what we were already spending in the worst case scenario with the 50,000 stop loss. So minimum would actually be 1.3 million, maximum 2.5, and then the average cost on this was 1.6 million. The staff currently contributes just over 400,000 of the premium, so that would leave the JWSC with 1.2 million versus the existing 1.8 million. So that's about a $600,000 on average savings with these simulations, and 99 times we saved money. Couldn't quite get to 100, but 99 times we saved money. The 75,000, it looks very similar. If you compare these two charts here, you'll notice how the frequency shifted slightly to the right. They're still fairly clustered there, but you got a few more that are hanging out on that right side. Again, minimum cost is in about the same range. I think the one before was 1.33, this is 1.37 million, and the average cost is 1.8, or about $500,000 savings versus the $800,000 savings you had before. And 3 times out of 100, you did exceed the existing costs. However, the maximum overrun was $329,000. And then over here on the 100,000, definitely get a more broad response with the 100,000, just because the number of those claims that we could end up in that $50,000 to $100,000 range. You still save money the vast majority of the time, but you've got a wider range of potential outcomes with that. Similar numbers on the minimum, maximum is similar, but the average is at 1.9 versus the 1.6 from before. So if you look at it, the difference is you're going to pay a higher fixed cost with the $50,000 stop loss, but you're more closely reining in what your total cost could be. So you're paying more fixed, and if you had the perfect claims year, you will spend more money with the $50,000 stop loss than you will with the $100,000, because you won't have many people use it. But I don't think it's likely that we're going to ever have a year where we're not going to need some level of stop loss coverage. So based off of this, my recommendation would be to go with the $50,000, just so we can more closely predict our actual cost at the end of the year. Now, one of the things that's been brought up during the insurance renewal meetings is what percentage of the cost joint water and sewer pays versus the employees pay. Now, certainly we would, if we move forward August 1, we would keep the costs for our employees the exact same, and we would, as a result of that, the employees would pay a higher percentage, but of course joint water would be taking the risk if we went over at that point. And if we had a better year, then the employees would pay more towards their health care than what they currently do. Currently, employees pay about 400,000 off of the 2.2 million. So you'd be looking at about 400,000 off of maybe 1.5. So the employees would not see a difference in their deductions. So there won't be any impact to them, but certainly if with the better year we had, the more the employees are contributing to their health care coverage, and it also gives them a little more control over their health care coverage because they could see these benefits pretty quickly when we start doing the annual financials and things of that nature.
Okay, how would you cash flow the initial year?
Currently, we have a capital reserve that we fund at $300,000 a year that's got $3 million in it that we've been funding for, John, how long has that been funded? Since 2010, so essentially since we started, that has never been touched. So we've got a ready-made reserve we could use we could transfer that to the medical reserve to get started. And then we would collect the premiums from the employees to continue to put that in there, and that would be my recommendation of how to do that. And at the end of the year, if we have a budget surplus, we can certainly take some of that money, and typically we put it over into the R&R. We could take some of that money and put it into the medical cost as well.
I think I would feel more comfortable if for the first couple of years you took any savings
Sure.
and put it in.
Yeah, absolutely. Each year, when you save money at the end of the year, we would go ahead and fund that, what we're currently funding the cost.
I would say that rebating some back to the employees, which would be fair, should wait for that to.
Yeah, sure, absolutely. So we would basically be making our payments, instead of making it to United Healthcare, we'd be making our payments to ourselves to that reserve. Because we already budgeted $2 million for insurance, so that's already budgeted in the FY21. So we would just make those monthly payments to our own reserve.
That's just my feeling. So I kind of go around and get a sense of what each commissioner feels. I guess what I'd like you to address, do you want to do self-funding? Are you comfortable with the $50,000 stop loss? And are you comfortable with taking whatever savings we get and plowing it into the reserve for the first couple of years, 2 or 3 years, and everything, so that the director can then structure a proposal for the commission to review and vote on tomorrow?
With that, the employee's cost will be the same every year for the next 2 or 3 years, right?
Essentially, yes, sir.
That's pretty good, too.
I think that insurance costs tend to go up every year for everyone, and if you could come out and tell the employees that their insurance cost wasn't going to change for 3 years, they would be dancing in the streets.
I want to see that.
Yes. Not me dancing. I'll find somebody that's better than I am.
I'll offer a few comments. One, I think we've got a good plan for our employees, and we need to stabilize that for premiums. This is a way to get us there. We can take the risk. We got good cash flow. We've managed the company very, very well, so we can do that. I would further say that any savings that we get from budget, so if we budget $2 million a year and it costs us $1.5 million actual, that we move that surplus, if you will, or how we want to call that, into the reserve for the period of time that we commit. So if we commit 3 years or commit 5 years, we put that in that reserve. And after 3 years, we can review that, because there are a few runs in these simulations that the cost would far out exceed the budget. And so we need to prepare for those times that it can occur. And that's what we're about doing, is managing that risk. And we're really managing it for our employees instead of just passing that cost on. Then after year 3, as the trend continues to improve, Commissioner, is that we do offer that rebate to our participants that are in the program, because they're the ones that are generating the savings by having lower cost. And so that's what I would support.
Absolutely.
And to feed on that would help us if we can add to those reserves. Those rebates could be tied around health with the smoking cessation and joining the fitness kind of incentives. So I think it's an presentation. I think it's the way to go, and with a 50,000 cap loss.
We had actually talked, if we do this for an August renewal, we may announce when we have the meetings with staff to sign back up for the same plan they're on, we would announce that a year from then, we would start doing the BMI and tobacco testing to give them a year to sort of get on the plan, so that maybe we could start offering some level of incentive on the monthly premium for those folks. We've talked about doing that in the past. But certainly we would announce that they're still going to start being checked the following year to give them a little bit of time to study for the test.
I'd be willing to support the presentation. I would expect to come out of this as a recommendation from staff. And I think, in my view, I'd be ready to cast a vote on it in support of it tomorrow.
So do we need to make a recommendation to bring this to the full committee?
Yes.
Tomorrow, and amend our agenda to,
We haven't heard from.
I agree, I listened to what everybody said, I agree in the beginning, what you said in the beginning about putting the reserve and stabilize first before we decide to give the incentive, because we don't know exactly what's gonna happen yet. We gotta figure out the trend as to how it's gonna go. We may have a spike, or something may happen that we might have to use those reserve funds, and then if we give our incentive already, then we gotta go back and borrow some more funds from some other place. So I think the way we're going is fine. The city of Brunswick has a self-funded program, and we've been doing fine with it. Every once in a while we have a blip, but we're able to manage that. Like I say, you manage your risk. That's basically what it is. And stop loss has really come in effect for us to help us as well to go through that gap insurance thing. So I agree, sir. Let's put it on the agenda for tomorrow.
I think that this is a great opportunity for us to take something that's very difficult and we're at a disadvantage with insurance companies, and to be proactive about it and find a good solution that's going to be good for the employees and good for the organization. So I'm all for it. Absolutely.
and I'd like to say, I know this has been an awful lot of work, and thank you to all that has participated in bringing this to us. I think it's gonna be a huge benefit to us over the coming years.
Well, thank you for that, but Commissioner Cook made a point at the beginning that we could be budgeting a 45% increase in the next 3 years, which would be somewhere in the neighborhood of $3.2 million on our budget versus the current amount we spend. If you look at the numbers we ran, even the worst-case scenario is $800,000 less than that. So if you look at that from a rate perspective, that's a sizable amount of money that we won't have to pass on to our ratepayers.
The employees would end up having to take more out of their pocket.
Absolutely.
Have that increase like
Absolutely.
that. That's going to make a big difference. So.
Yes, sir.
Okay, so I guess I need a motion to direct the executive director to put forth program that keeps the money that we save in the program, how long that'll be, which is 5 years. I think that this is good, and with consideration at 3 years of offering rebates
Sure.
To the employees,
Absolutely.
and bring it before the commission
Well-
tomorrow.
We'll have you something tonight to review before tomorrow. We won't just bring it in here at the 2 o'clock meeting and say, here, this is what we got for you. So we'll have something to you tonight.
That'll be good.
So it kind of murdered that, but if I get a motion.
I tell you, when you say so moved, what do you say?
And second.
Any further discussions?
Can I would say one thing? I just want to thank Katina for the wonderful presentation and all the efforts she's made and the work, and she's come up with a really great plan, and I think we all appreciate your efforts. You earned your keep in just one short time for the entire year.
That's all I'm trying to do. Sir.
Okay.
Okay.
She earns her keep answering all the idiotic questions I come up with, so.
Not at all.
Okay, all those in favor, please raise your right hand. Okay.
Who motioned, who seconded?
I motion, he second.
I also would like to add my congratulations to Katina and the teamwork staff and our staff putting this together. I didn't really know where this was gonna go when we started. I just wanted to investigate to see if it made sense. It appears it makes a lot of sense, and I'm very happy with the work that you all have done. Thank you.
Yeah, I'll echo that, Commissioner, is the push-ups you've done has made it easy for us to make a decision. The analytics are simple, they're straightforward, and it helps us to understand what's our risk, what's out there, the worst-case scenario. It makes us very easy to make a decision on this for the work that you've done, really to set up the positive outcome that's going to help our employees and help the ratepayers.
Anyone else? Anyone got any other business for the Human Services Committee? With that, you're adjourned at 11.
That's a good meeting right there.
Yep, that's a very good.